Hello, I'm Dr. Paul Tinsley. I'm an ear, nose, and throat specialist here in Olean. I've been here approximately a year and practicing my specialty for approximately 35 years. I'm board certified in facial plastics, head and neck uh, tumors, and sinus conditions, as well as other common ear, nose, and throat problems. Today, we're going to discuss a little bit about patients who have stuffy noses. And when a person comes in with stuffy nose, the first thing I like to do is explain to the patient what the nose does. And I think it's the basic functions of the nose. Warms the air. It tends to clear the nose of bacteria, viruses, and other pollutants. And it also is an organ which allows us to have the sense of smell. And our taste is about 50% smell. The patient's most common causes that cause them to have stuffy noses is colds, viral infections. Each person commonly has 2 to 3 colds a year, and these symptoms will last for approximately 5 or 6 days, and then they resolve at that time. Treatment of colds are symptomatic. Basically, for the stuffy nose, saline spray is a good alternative to keep the nose moisturized. You can have colored secretions of your nose during a cold, since it is clearing viruses or bacteria that could cause the symptoms. If the organisms persist longer than 6-7 days, then we'll get into other infections of the nose. But commonly, it's appropriate to start prescribing antibiotics probably within the first week of nasal stuffy symptoms. Also the importance of explaining this to patients so they can use humidification at home also is another alternative. There have been some information that heated air is more effective than just cold mist. There are devices which you can obtain across the counter in the pharmacy to use for this purpose also that patients might need. The patients also, other common cause that we see for patients with a stuffed up nose is sinus infections. Sinus infections usually are caused by bacteria or can be precipitated by our allergies, inhalant allergies, or either can follow a viral infections such as colds. So when you have symptoms that are lasting more than 7 to 10 days, it's when you start thinking, does this person have a sinus infection? Most common symptoms will have the throbbing pain behind their eyes. Their teeth may be hurting. They may have increased amount of nasal purulent secretions. They may complain of postnasal drainage or blow it out of their nose. They may have more pain over their cheeks specifically. At this point in time, it probably is appropriate to begin the use of either a systemic decongestant if they can tolerate Sudafed, or a topical decongestant for at least a week. This symptomatically makes them feel a little bit better. Using saline nasal spray in their nose and placing them on an antibiotic. The antibiotic we usually choose is amoxicillin. It's considered the first treatment if they're not allergic to penicillin. And then you can use Zithromax for one also. If you're dealing with people who are having chronic infections and say their symptoms have been going on for a month or so, you could use Augmentin, more broad spectrum, or you might choose to use Bactrim, which is another alternative. Zithromax is not that effective for sinus infections per se. If a person begins having recurring episodes of sinus infections or a sinus infection persists for months, then there are other options of management. If a person is still having symptoms at 3-4 weeks, then it is appropriate to get a CAT scan of the sinuses to look at them radiologically. A person also can be worked up for allergies, which, as I said, could be a contributing factor of people having sinus infections many times during a year. Other treatment options begin with surgical intervention for sinus infections that are chronic, but that is another subject of discussion. The other cause we see for nasal congestion or blockage is more of a long-term problem, and that being a structural problem within inside the nose. As you know, the nose is divided into two halves, with the center wall dividing the two sides called the septum. The septum is made of cartilage and bone and extends from the front of the nose back towards the nasopharynx, or the backside of the nose itself. You can have a crooked septum to one side or the other that they could have had all their lives, or it could have resulted from trauma. These are a surgical problem if the person prefers to have it corrected. You may see a lot of septums that are crooked, but the person has no desire in having them fixed. They can interfere with their sleeping at nighttime, and that you will find that if the septum is crooked to the left side, for example, causes significant obstruction, they will sleep on that side at night, so their good side, that being the right side, is up, and it will not congest, and they can breathe freely. The next problem we see is a condition called vasomotor rhinitis. That is a problem in which the turbinates or structures inside the nose that warm the air become dilated or expanded with blood. And these do this normally and alternate from side to side, but when they become a significant problem all the time, then this can be addressed. The first line of treatment is usually a topical nasal steroid spray, such as Flonase or Nasonex, and some patients respond to this. You will find that patients may not have symptoms during the daytime, but only at nighttime when they lay down, and they complain of difficulty breathing through the nose, and the nose stays congested all night long. They may turn from side to side to be able to breathe through one side when it is not congested. If patients are plagued by this chronically, there is a simple surgical procedure. It takes approximately 10 minutes under anesthesia, in which you insert a small needle while the patient is asleep, and you shrink the tissue that keeps it from then re-expanding as time after a couple of weeks, and people are very happy. We see patients who have sleep apnea and have difficulty wearing their CPAP because they state that when they put it on at nighttime, that their nose will become blocked up and keeps them from wearing it. So this is a nice technique to prevent this from occurring. The other problem that we see is patients who are smokers, and smoking tends to paralyze the cilia, that is the small hairs inside the nose and sinuses that keep clearing all the mucus in the nose back to the back of the nose until we swallow it. And when you smoke, it paralyzes these cilia, which prevent them from working. Therefore, you increase the amount of nasal stuffiness and sinus infections. Some patients use nasal lavage, such as neti pots, to rinse their nose out daily, just as routine nasal hygiene, and this can be very useful in these conditions. It's normal for you to make 1 to 2 liters of nasal secretions each day that are being secreted by the nose. The purpose of this is to trap bacteria or viruses or other pollutants, and it is usually a thin, watery type drip, which you do not notice, and it goes down the back of your throat. So when the thickness or viscosity of these nasal secretions change, whether it be from infection or pollutants, that's when people come in and complain of postnasal drip in their throat. One thing I notice is that when patients have symptoms that they state that their throat bothers them and they have postnasal drip, if they point towards the up aspect of their neck, sometimes will be most likely nasal. If it's down in the lower part of the neck where they talk about the drip, then that may be from refluxing. So in questioning people, asking them where they localize it to can be useful. It's also important to realize there can be more than one thing doing it. So a person could have increased amount of nasal secretions and reflux at the same time. As far as allergy, you also use that. You treat with antihistamines, and if they have it chronically, then you can have them allergy tested. If there are other things that you have questions about, feel free to contact my office, which is located at the Medical Arts Building and Olean, New York. Thank you. Hope this has been useful information for you today.